give us a call at 516-595-8150 because we want to hear from your point of view what's going on in the medical field and how they are treating the medical workers. If you want to talk about that, because I know that's probably a situation you'll talk about, but if you want
I'm actually here, Seneca. I'm on Twyla.
Oh, okay.
I've been listening the whole time.
Do you want?
Let me say this to you real quick, Shan. Let me tell you this real quick. Our number of clients, like I said, we are working. The problem is this. We've had to change our system almost 3 times. We have now, we have a whole nother area that's helping us with the phone calls, even us from workers, because, and this lets you guys know how many people are filing for unemployment benefits. It's even hard for us as workers. Tomorrow, I'm pretty sure when we go to work, it happens every Monday because everybody files for unemployment benefits starting last night at midnight. Every week, at least every Monday, our systems run so slow and sometimes they crash because the number of people that are filing claims, the number of people that are calling into our office, all of this is on a whole server together. So for us to be able to call back out to claimants, call employers, and to use the system, it's causing our system to overload. So we've been telling claimants now, when we reach out to them, and we've now, as of last week, reached out to, they have someone else that is assisting us with those phone calls to free up some space on our servers so that we can get out to call claimants in regards to their unemployment benefits. We have, I'm telling you guys, when I say thousands and thousands, we have people in departments all over. When I say top people, we got top people doing claims. Ain't never touched or done none of this. That's how much we have coming in for these unemployment claims. What I can tell you is your claim will be backdated.
Anything, and I'm like, what is going on? Because I got a friend that works there too. Her name is Tish, and she actually said she was going to try to help me tomorrow and see what was going on. But this is my third time filing a voucher, and I literally haven't heard anything. So I started getting a little concerned, and I was like, well, I'll give you time.
Yep, our systems are very much. They're very, very backed up. And like I said, so what they're doing, it does, whenever you file, it's still retroactive back to the first week that you filed for unemployment benefits. And that's why they've been telling people that it'll at least take about 4 weeks or sooner before you would even get. The problem that people don't understand is because we have such a massed amount, and not to put it like this, but you always have your scammers. So there's certain rules that the federal government is making us abide by. We have to verify and make sure. Yeah, you telling us that this, and this has happened, but I'm telling you, our fraud overload of how people are filing benefits, because now people are thinking it's a free-for-all. Oh, okay, well, let me try to hurry up and file for unemployment benefits and see if I can get some of this money. So the problem is it's sad because the people who need the money and are truly laid off or are affected by this, we have to treat everybody the same way because some people are good and well that they shouldn't be entitled to nothing. And that's something else that they are working on so that we can speed up the process. We have incorporated some things in our system, but I'm just telling you, be patient with us. But we really are trying our best to hurry up and get these claims done for people, but it will be backdated. So just keep filing your voucher and keep doing what you're doing, and they will definitely pay you. You will be paid.
I will.
Okay.
I will say, I'm going to jump in real quick, guys. I've been hearing that this is not only just something that's been happening in Indiana about the servers and things crashing. I've been doing some reading about other states and how they've been handling the unemployment situation. This has definitely been happening in other states. The number of employment claims that have been coming in are in the millions. So this is very much a troubling time. And I'm just really afraid about how this economy is going to turn once everything settles, the dust settles around this. So, I want to go to another call quick. I just want to see if they have something to say, and then I'm going to move on because I need to get to the Clark sister review, and I also want to touch back on that situation that happened about a month ago when the young lady was killed in Indianapolis because of the DL situation. So I want to get on that, but I need to go to the caller ending in 2693. Do you have a comment, or are you just listening at this point? Caller ending in 2693. Are you listening? Okay, they're probably just listening. We just want to thank you for listening. I just want to thank everybody so far. I've been trying to keep a check on the chats too, because I know some people have been sending chats and stuff like that. I want to move on really quick because we've really been talking about some really good information, and that's what I'm talking about. This show is a tool where people can use this information and apply it to their daily lives, because this is information that some people may not have been getting. You know, there's been a lot of confusion about the unemployment situation, how to file claims, what's coming down the pipeline. So we really want to thank the caller for giving us clarification on what to expect coming down the pipeline.
I just wanted to kind of touch base on the medical field part of it, because I've actually been off or whatever, and I know some of you don't know, but I'm actually working in the healthcare field. I'm a registered medical assistant at Community East. I work in the neurology department, and I was recently found positive for COVID-19, so I've actually been out for about 3 weeks. A little bit of what was going on, like the time that I was there. I do know that they did take the precautions at Community East. Like, they were like very cautious of who was coming in and who was coming out. And, we had to be masked up and gloved up. We did everything we could do basically to protect ourselves. I just feel like at this point I was the only one in the office that was positive for COVID-19, even after taking those precautions. I just want to say the most important thing that I feel like everyone should do that was very, very important is washing your hands. Even if you are a person that washes your hands, I would try to double or maybe triple that than what you're usually used to doing, and even increasing it to over 60 seconds if you have to. And I'm talking about any time you're touching something or any time someone around you is coughing into their arms, or, anything. Just if you're touching anything, I just really, really, really encourage those of you to really, really wash your hands more than usual. You know what I mean? So that's just what I wanted to say on it, because I felt like I was doing that, but now that I was found positive for this, I felt like I should have done it a little more, especially working in the field.
And let me ask you this, Chan, with you being on the front line, in the front end of this, and you're being exposed to this virus, and this goes for all healthcare workers, do you feel that how should I frame this? Do you feel, and I'm not, because I don't want you to, because I'm trying to frame it so you don't say anything, do you feel, in general, let's just say in general, do you feel that the healthcare workers are not being valued as much as far as a lot of these hospitals are concerned? Are you feeling that they're not equipping the healthcare workers with the tools that they need to protect themselves from this virus? There should be more? Is there more that could be done to protect them?
This is what I would say on it. Like at first, like I said, I was the only one that got tested in my office for COVID-19, and that was because I took it upon myself. Not trying to shade anything, but I just feel like nothing was taken seriously, like, until I was found positive. Then that's when they were like, okay, everybody needs to be 6 feet, blah, blah, blah. And I'm just like, okay, that's something that we should have been doing when this happened in the first place. That's just my opinion on it. You know what I mean? I feel like everybody should have been tested, you know what I mean, from the
right.
You know, once this thing hit the media the way it did, I feel like everybody working in that field with any type of symptoms should have been tested immediately. It shouldn't have took me as a working in that field or working in that office to get tested, taking it upon myself to do it for them to start taking it seriously.